Welcome. In this lecture, we speak about Staph aureus, diseases, isolation, identification. Staph aureus. Staph aureus can produce disease mediated by toxin or by direct invasion and destruction of tissue. Staph infection range from superficial skin infection to fatal systemic infections that can occur when the integrity of the skin is damaged, thus giving this pathogen access to sterile sites. Among the more common Staph aureus infections are boils, folliculitis, cellulitis, and impetigo. Immunocompromised hosts are at particular risk of infection. Septicemia, which can result in the seeding of distant sites producing osteomyelitis, pneumonia, and endocarditis. Toxogenic strains of Staph aureus are capable of producing bolus, impetigo, scald skin syndrome, and toxic shock syndrome. Staph aureus is also well known as a contributor to food poisoning due to the elaboration of enterotoxin in food such as potato salad, cream, custard. Intense vomiting and diarrhea usually occur within 2 to 8 hours after ingestion of food containing the toxin. Gram stain of Staphylococcus aureus. A gram stain of a positive blood culture shows gram positive cocci in grab-like clusters on subculture to solid medium. Gram stain of Micrococcus latus. Staphylococcus aureus on blood agar, shown in this image culture of Staph aureus, grown overnight at 35 degrees on blood agar. Colors are creamy colored and opaque and have a smooth entire edge. A zone of beta hemolysis surround the colony. Golden pigment of Staphylococcus aureus. Staph aureus is capable of producing the golden pigment that lead to its species name. In practice, strains which this degree of pigment are not frequently isolated from clinical specimen. The isolates shown was incubated overnight on blood agar at 35 centigrades and left at room temperature for an additional day. When left at room temperature or refrigerated following incubation, isolated tend to develop more intense hair size variation of Staphylococcus aureus. Staphylococcus epidermidis on blood agar. Staphylococcus, other Staphylococcus coagulase. Slight coagulase test. The slight coagulase test is rapidly assay that test for clumping factor on the surface of the organism. The test is performed by emulsifying the organism to be identified in auto agglutination left and rapid plasma right. Agglutination of the organism only in plasma is a positive result. Staph aureus is positive by this test as shown. Coagulase test. A common method used to distinguish Staph aureus from other Staph species is the tube coagulase test shown here. Staph aureus is positive and others are colonies of the isolate to be identified were emulsified in 0.5 ml of rapid plasma. The tube was incubated at 35 centigrade for 4 hours and tipped gently to look for clot formation. The tube on the left is with the plasma remaining liquid, while the tube on the right is positive, as evidenced by the clot. For latex test for identification of Staphylococcus aureus, in this test, depict air latex particle have been coated with antibody that can recognize bound coagulase as well as immunoglobulin that will bind to protein are present on the surface of the strain of Staph aureus, which serve as a negative control. The isolates to be identified were emulsified with coated latex bead. The isolate shown here was identified as Staph aureus. Mannitol salt agar. Mannitol salt agar is a selective and differential medium used for the isolation and presumptive identification of Staph aureus. The high salt concentration inhibit the growth of many organisms that inhabit skin and mucosal membrane. The phenol red indicator incorporate into the medium detect acid production. Yellow result from the fermentation of mannitol salt agar containing oxacillin. Mannitol salt agar with oxacillin can be used to screen for presence of MRSA in nasal specimen.